IPAC for Staff, Module 8, Cleaning Bodily Fluid Spills. Spills like blood, urine, or vomit need to be contained, cleaned, and disinfected. Here are the steps for cleanup. If using a spill kit, block off the area to prevent others coming in contact with the spill. Perform hand hygiene and then put on any PPE required based on your risk assessment. Gloves should always be worn when cleaning up a body fluid spill, and if splashes are expected, other PPE such as a gown should be worn. Sprinkle the spill evenly with fluid solidifier and allow a minute or so for the liquid to solidify. Be careful not to splash. Remove the solidified material by using the scoop and scraper. Place the material into the disposable bag. Wipe the area with an absorbent towel. Then disinfect using the CaviWipe. The area must remain visibly wet for 3 minutes. Close the waste bag and put it into a regular trash bin. Items that are not dripping with liquid if squeezed can be disposed of with general waste. Once the area is clean and disinfected, remove any personal protective equipment. Spill kits come with hand wipes and can be used if no hand rub or soap and water are available. But if you can, wash your hands or use alcohol-based hand rub. If no spill kit is available, use the following steps with products provided by the health unit. Look closely at the area for splatters or splashes. Put on personal protective equipment that you think you'll need. Use disposable towels to wipe up the spill. Put towels in a regular garbage or yellow biomedical waste container if towels are so wet they're dripping. Remove gloves and use hand rub, then put on a fresh pair of gloves. Disinfect with hospital-grade disinfectant, allowing the appropriate contact time. Wipe the area again with disposable towels and throw out in the garbage. Remove personal protective equipment and be sure to wash your hands. If you have any questions or concerns, contact a member of the IPAC committee.